sometimes the duty doctor, they feel to, go with their friends, right? Play with their friends. They just keep stuff on you and then they take leave, right? So they just say, we have 2 patients in the ward, please do catheterize. We have 2 patients in the ward, for 7 days they have the police catheter, please change the catheter, right? So that these are common procedures which you should know. Is that clear? So what you should know is during the catheterization, the genitalia or the urinary tract is one of the potential site for the complicated infections in the hospitalized patients. Understood? So what you should do is you have to take care about the sterility, the sterilization procedures first, right? So keep everything clean. First you do your hand washing, right? You know the steps of hand washing, right? So you take you have at the side, you have the top, right? And then you have the tap, so you just take the soap and the detergent what you have in your hospital. Take it, wash your hand, yes? Just wash it, you know the steps of hand washing, yes or no? Yes. So just wash it and then clean. Clear? After that, you just, the helper staff. If you don't have the helper staff, first you have to take the glove, be ready, drop this glove in the tray without touching, and then go to hand wash. If you don't have the helper staff. If you have the helper staff, you can go and wash your hand, your helper staff will drop the gloves for you. Understood? So that, for example, now we wash the hand and we have the gloves, yes? And in this gloves we can see the right side and left side written, yes or no? So right side means using right hand, left side means using left hand. The next thing we have to understand is we wash the hand, but still our the skin is not germ free. Yes or no? We have lots of the microflora in our skin. So that just don't touch the glove, just touch the paper from the top, right? And then you're right-handed, you're left-handed. If you're left-handed, you can use the left glove first. If you're right-handed, you can use your right gloves first. Is that okay? So while using the glove, what you should do is don't touch on this side. Touch this side. Because this will fold and go inside. Yes or no? So it will not contaminate the patient. So touch this side and then use your hand like this, right? So insert your hand, fingers first, and don't touch here, just touch this. Because it's going inside. Yes. Touch this way. And first you see the fingers inside. 4 fingers. Yes, 4 fingers. Just arrange the 4 fingers. After arranging the 4 fingers, find your thumb, right? Pull it up. Then don't touch. Just leave it. And then you can touch this side now. Is that clear? After doing this, don't touch this inside now. Just touch outside. This way. Is that clear? Understood? After that, similar like before, insert your fingers inside. Find the 4 fingers again and see how am I folding. I'm not touching this side. I'm just folding this side. Because this is sterile and this is sterile. Yes or no? So just touch this side like this. Find your 4 fingers first. And then insert your thumb again. Like this. Put it up. If you have the walls and anything else, you have to cover like this. This one also, don't touch inside. Then yes, after doing this, make it fine. Before doing this, you can choose the glove size. See? The size is written here, yes or no? If your hands are smaller, you can choose the 6.5, yes? If your hand is fat, big, you can choose the bigger size glove. So once you do this, the paper is like this. Don't touch outside, touch inside. Is that okay? It's really easy. Is that clear? After this, now you start with the painting first. Everything is exposed, yes? In the penis, some penis are circumcised. Some penis are uncircumcised. Yes or no? Yes. Circumcised penis means? Foreskin has been removed. Yes? So, in this penis, is it circumcised? Yes. You can see it is circumcised. Yes or no? Because we can't see the prepuce here. Right? When we cut the prepuce, the penis is circumcised. So, this is circumcised. So, if it is circumcised, no prepuce, no covering. if it has the covering, we have two options. Before wearing the gloves, we can use the other top gloves, loose gloves, and then we can retract. Yes? Or we can ask the patient, if the patient is conscious, please can you retract your penis for me? Yes? That patient will retract by himself. Is that clear? Otherwise, before wearing your sterile gloves, wear the loose gloves, retract the penis, and then go for the sterile gloves. Is that clear? After this, now in in our, we have like this the bowl, or we have the kidney trays. Yes, in this we can take the betadine solution, the iodine solution. Is that clear? And in this iodine solution, we have these gauze pieces. These are called gauze pieces, right? These gauze pieces are of different size. Is that okay? For what purpose we use? For usually for the for swabbing purpose, we use this size of the gauze pieces, and different qualities we can get. If the hospital is very rich, they can buy a good quality gauze piece. Otherwise, they can buy, you can see somebody from here. Understand? So this depends on the quality. So first you make this three-fold. After that, fold it from one corner like this. Is that okay? After this, fold it from this the next corner and make it a triangle shape. Do you understand?
Yes.
How I fold it? Once again, first unfold it. Yes. After that, fold from one corner like this. Is that okay? And then fold from this next corner like this, and then you'll make it triangle. Is that clear? After making this triangle, you can hold it in your finger like this. Clear? Similar like that. The next also, fold it and then hold it. Yes? This one is folded already. Somebody done for me. So we just fold like this. 3 swabs. What are those?
3
swabs. After this, this is our sponge holder. What is this? So just take this sponge holder and then take any one first. Any one swab. Before it was the gauze piece. Now this is a swab. What is this?
Swab.
Now I have betadine here. Yes or no? So I use the betadine. If it is sterile, in the hospital, if we have this set, the dressing set, in the dressing set everything is sterile. If we don't have, if we have to use the extra bowl from outside, don't touch it. Is that okay? Otherwise, if it is in the dressing set, you can hold it because it is sterile. Yes, you have a betadine here. The sister will help you to drop the betadine. Yes. After that, start painting from the glans penis. Do it in circular motion. Understand?
Yes.
After that, go to the neck of the penis. Go to the shaft. In the shaft, go downwards. Is that clear? Which surface is this one? This one. Dorsal surface. This is the ventral surface. Is that okay? First is what? Glans penis. Neck, because this neck has lots of sebaceous gland, yes or no?
Yes.
So lots of dirt get accumulated here, so we have to clean it properly. Understand? After that, dorsal surface, lateral surface, right? Ventral surface, clear? Scrotum, done. Don't go down. After that, up. Clear?
Yes.
Yes? Then mid thigh. Is that clear? Here is the potential area of accumulation of the dirt. Yes or no? So this area, and then this area and this area at the last. Because this is near to the anus. Yes or no? So this area has lots of bacteria. So clean it at the last. Clear? After that, drop it into the dustbin. While dropping, don't drop this below your waist, because this area is your dirty area. Above this area we consider as the green area. Green area means the clean area. Is that clear? So that don't drop your sponge holders below your west, just from here, straight down like this. Is that clear? Similarly, take the next valve, hold it, dip it. Again, we did how we did it. Yes, first is glans, then neck. After that, shaft which surface?
Dorsal.
Then lateral, then ventral, then yes, this side scrotum of upper surface. Then we are going to the pubic areas, abdomen, yes, then mid thigh like this, yes. Then after that, these areas, perineal areas. Clear? Done again? Yes. Now the last one, the last swab we use to clean only the glands. We clean the meatus. This meatus where we have to insert the catheter. Clear? So we clean the meatus, the glands only, yes, and then the penis. Done? Clear now? So we finish the cleaning. After cleaning, we don't have the use of this one. You can discard it out. Clear? Now we go for the draping. This process was called the painting. What was this called?
Painting.
After that we go for draping. Draping, we have one eye towel. I don't know what we have or not. Yes, we have eye towel. This is also folded like this, and it is kept in the dressing sets, right? It was all sterilized and then kept in the dressing set. So we open. While opening, remember, don't do like this, because it will touch your body. And your body is on sterile, yes or no? So just hold it up over your chest level, like this, right? After that, don't do like this. If you do like this, you may touch, yes or no? So that, hold it like this, go opposite to the patient, and then without touching. Is that clear? Don't move your hand down, because this area of the patient is on sterile, yes or no? So from the up to this down. Is that clear? After that, this towel, right? Clear? Yes? So now this whole area is clean, because this is on sterile. Yes or no? Yes. Now you have a catheter set here. Yes? We have a tray. I'll keep this catheter set here. Easy for me to handle. Yes? This is here. Yes or no? So now what I do is I use 3 syringes like this syringe, 10 ml syringe. How much?
10 ml.
3 syringes. 1 syringe I'll fill the lignocaine or xylocaine gel, right? A local anesthetic. So I'll just fill it. For example, I'm filling, yes, 10 ml. Otherwise, I can just pull it up like this, and then I can ask the sister to fill from up. Clear? Or if I have the sterile set, I can fill by myself from the top. Close this from the lower side. Done, yes? Keep it. Next syringe, 10 ml. We have the sterile water. Sterile water I can fill. 1 syringe. I'll keep next side. The next syringe again. So we have 3 syringes. 2 syringes with 10 ml sterile water. 1 syringe with 10 ml of xylocaine or lignocaine gel. Clear? I fill it. Now I clean this all. Now this area is very clean, yes or no? What I do is I hold the penis. Better if you have the gauze piece. Use the gauze piece. Wrap the penis like this. Yes. Hold it. Yes. Try to hold by the neck. Make it vertical. Is that clear? Why? Because when your penis is like this, you have the urethra going up, down, and then up. Like this. That's it. Yes or no? So when you hold it like this, your urethra goes down and then up. That means it makes only one curve. Understood? So before 2 curves, while passing the pipe has to pass 2 curves. Yes or no? When we hold like this, it makes only one curve. So only one curve. Passing one curve is easier than passing 2 curves. Yes or no? So less chances of injuring the urethra. Is that clear? So that hold it first like this by the neck, right? Neck of the penis. Hold it. Take your xylocaine gel like this. Yes? Clear? Slowly. Don't forget to take the consent of the patient. Otherwise, patient will shout at you. Yes? So just take the consent. I'm going to do these things. Please, no worries. Don't get panic. If anything else, please tell me. Right? Slowly inject and keep watching. It's obstructed. Don't make this video, okay? The obstruction video. Okay, so slowly look at the patient's expression, because if the patient has some pain or any irritations, he will express by the face. Yes or no? So keep looking, keep talking. You can tell some story to the patient this time. Yes. Otherwise, you can ask something about his family members, his son, his daughter, his wife, his girlfriend. Yes or no? If recently got break up, don't talk about the girlfriend. Yes, that we should be careful. So keep talking, keep injecting. Yes, inject it. Talking. Done. Yes. After that, wait. As you remove, don't forget to close this tip, the meters. Otherwise, the gel will flow out. Yes or no? So keep closing and use the penile clamp like this. Yes. This is not the penile clamp. We have the rubber penile clamp, right? So use the penile clamp and just clamp the penis at the neck like this. Is that okay? And keep it. Wait for 5 minutes. Keep talking with the patient. Till then, don't touch your body with your hand. You can do like this, right? Hold your hand like this. Keep talking with the patient. If you have the beautiful sisters by the side, you can talk. Right? Yes. That's the opportunity for you. There's nothing to do at this time. Yes or no? Yes, sir. Talking with your colleagues and the sisters. So once the 5 minutes is done, why are we waiting for 5 to 10 minutes here? Because we injected, yes, we injected the local anesthesia, yes or no? Yes. And we inject only the 10 ml, right? The 10 ml should pass through whole the J shape of the urethra up to the bladder, right? Yeah. It should anesthetize the whole length of the urethra, so that we are waiting for 5 to 10 minutes. Till then, the whole urethra gets anesthetized. Is that clear? After that, we will remove this clamp. Yes, we hold the penis. We hold again vertically like this. We take the catheter. Yes, and remember, this catheter should be holded properly in your hand. Hold it properly, dip it in the gel, anesthetic gel. After that, tell the patient, I am inserting the catheter in your genitalia. If you feel discomfort, please take long breath. Is that okay? So patient will be busy in taking the, will be busy, yes or no? Yes. Till then you do your job. Like this. Yes? Slowly and gradually, like this. Now can you bring that catheter from that room? That room, yes. We have one catheter. So insert it slowly. Don't forget to make the penis vertical. Understand? So go slowly and slowly. Insert it. Insert up to this angle. Is that okay? And this catheter has, you can see, these 2 channels. Can you see? This one channel is for inflating the balloon of the catheter. For what? Inflating the balloon. And this one for the urine output. Is that clear? This is already attached with the urine bag, yes? So this, we can follow 2 procedures. Either we can get this attached with this already before inserting, yes? Or the next, once after inserting, after inserting, we can attach the bag. Is that clear? So for example, now we haven't attached the bag, we just insert the catheter first. This channel is for urine output. As this catheter inserted inside, we can see the urine flow from this channel. Understand? If urine does not flow, what should we do? Thank you. So if the urine does not flow, we have two the syringes filled with the distilled water. Yes or no?
Yes.
So I'll take one distilled water syringe. I'll inject in this channel, right? Making it perpendicular. Inject it. Yes. Why am I doing this? Because look at here in this catheter, you can see a hole here. Yes or no? At the tip. Can you see from there, everyone?
Yes, sir.
This is the eye of the catheter. What is this?
Eye.
So this, we have eye here. Yes or no? But the eye of the catheter is at the length, right? This is opposite. So this eye, this is for the passage of the urine. We have full of jelly here in the urethra. Also, we dipped in the jelly, so this eye sometimes get blocked by the jelly, right? So the urine may not come out. In this condition, if we use this 10 ml of the distilled water and then we flush it, right? That means we have the 10 ml of distilled water. We inject inside so that this eye will open. As the eye open, urine begins to drip. Yes or no? You have to pinch at the side. Understand? Otherwise, it will drip in the patient's body or in the bed. Looks dirty. Yes or no? So pinch it and ask your helper or by yourself, because this area is sterile. It is just open from the back. You can attach this like this. Is that clear? After attaching, the thing is not done yet because this catheter was just inserted. Yes or no? It can come out, right? So what should we do is keep holding this, right? Till then, we have the next syringe of 10 ml distilled water. Yes, we take this 10 ml of the distilled water like this, and then remember this is one-way valve. What is this?
One way.
So this valve is tight. You have to use the force so that don't panic. Just use the force. Yes, is that okay? After that, done. And if you leave like this, this one, the valve is damaged, so that it's not retracted. Let me show this in this catheter. Is that okay? So let's see here. I use this 10 ml syringe. As I inject the distilled water from here, you can see the changes. Can you see? The valve is inflated. Yes or no? I'm applying the force. As I leave my thumb, look at here, the magic. It goes back itself. Do you understand?
Yes.
That's why, as you apply the force, you push the water inside, the balloon gets inflated. As the balloon gets inflated, keep applying the pressure and then pull it out. Is that okay? After that, this valve is one-way valve. It won't let this two flow out. Is that clear? This step is very much important. Everybody clear? So we did the same. So we inflate it, right? After inflation, applying the pressure, I'll remove it out. After we insert, we don't need to keep it again 90 degrees. Yes or no? Because it's already inserted, right? So leave it, relax, just do it. Once we inflate the balloon, try to pull it slightly, right? As you pull it, when the valve, this balloon, reaches to the neck of the bladder, it produces the obstruction. Understand? As you feel the obstruction, now leave it. Is that clear? Once you feel the obstruction, leave it. After that, you have already the Euro bag joined. Yes or no? Now, remove this. Everything is done. We don't need this thread. Yes or no? We don't need this as well. Yes? What we do, yes, keep holding, and then you have a helper. Helper will help you So like this, yes, and then don't stick the catheter, stick the urine pipe. Is that clear? In the medial thigh. If you stick the catheter, what happens? Catheter keeps pulling. Patient will irritate, right? That's why just stick your urine pipe in the medial thigh. Is that clear? After that, your back, you can hang it. Is that clear or not? So we finish the catheterization. Everybody understood?
Yes.
Now, after how many days we can keep this catheter in this the urethra? For how many days we can keep this? Yes, not more than 7 days. Is that okay? Because this is a rubber police catheter. It has higher chances of getting infection, as well as the complication is, as you are keeping it longer here, the skin from this tip may get stuck with this pipe, right? Produces the phimosis. Produces what? Phimosis. This is one of the complications. So the urinary meters may get smaller, right? Understood or not?
Yes, yes.
The skin may get contract. Is that clear? This is one of the complications. So one, infection. Next one maybe phimosis, right? So because of this, we should not keep this longer. We have different types of catheters. Some catheters, if some patients has the chronic urinary retention, for those patients, they need the catheter for longer, right? Chronic catheterization, for that we can use the metallic catheters, which we can retain there for longer. Is that clear? But this catheter, the Foley's, this rubber catheter, we should not keep for more than 7 to 10 days. Is that clear? Complication is infection or phimosis. Is that clear?
Yes.
What is the most common UTI causing organism? Most common UTI causing organism? Answer, please. Most common cause of UTI? Yes? E. coli. What is this?
E. coli.
Why E. coli? Why E. coli? Anus. Anus is very close. Yes or no? Stool contains 70% of the bacteria, yes? And that 70% of bacteria, 98% is E. coli. Understood? Yes or no?
Yes.
So we have the anus here. Every time we go to toilet, we wash it or we clean it. Yes or no? Some of the E. coli may get stuck in these perineal areas. Urethra is very close to the perineum. Yes or no? So higher chances of getting infections by the E. coli. Everybody clear?
Yeah.
So we did it. Now 7 days done. We need to remove it. How do we remove? How do we remove? We need to do nothing. The simple thing. What's the simple thing is, how was this catheter retained inside? Because of this. Yes or no? What we should do is, we don't need to maintain this everything now. Right? Because we are not putting something inside. We are putting something outside. We are not contaminating the inner structures. Yes or no? So just put the top gloves. At least you can do the hand wash. After that, you can put the loose gloves. Is that clear? Then take this 10 ml syringe, because we have infused the 10 ml sterile water here. Yes? Just take it as if it is here. Make it empty first. Don't fill it. Make it empty. Is that okay?
Yes.
After that, look at here the magic. Yes, automatically retracted. Yes or no? And this is also deflated. Once, pull it out. Throw your distilled water. Yes. Try once again. If something left there. Yes. If self not retained, try to retain by yourself. Like this. Yes. And keep pulling while removing. Clear? Throw it 2 to 3 times. Everybody clear? So it is deflated. Yes or no? Once it is deflated, again, make it straight. Try to slowly tell to the patient, I'm removing. Slowly. Slowly. If you feel obstruction, you should deflate it again. Do you understand?
Yes.
Otherwise, pull it. Yes. Hold out. Yes. Dump it into the dustbin. Everybody clear?
Yes.
This is how we can do the catheterization in the male. Everybody clear now?
Yes, sir.
Any confusion you can ask?
No, sir.
No? Fine. Thank you very much.